Hi all, welcome to Physio Exam Buddy. This video is on the endometrial changes occurring in the menstrual cycle. The endometrial changes during menstrual cycle, it is commonly referred to as the uterine cycle or endometrial cycle. And it includes three phases. First one is the proliferative phase lasting for around 11 days, followed by the secretory phase which lasts for 12 days and followed by the menstruation. Usually the duration of menstruation averages 5 days. First, we will see about the proliferative phase. The other names or synonyms for the proliferative phase are estrogen phase, pre-ovulatory phase, and follicular phase. Estrogen phase because the hormone estrogen is mainly responsible for the proliferation of the endometrium. That is why it is also known as estrogen phase. Pre-ovulatory phase means it just occurs prior to the ovulation and it corresponds with the follicular phase of the ovarian cycle. That is why it is known as the follicular phase. So this proliferative phase occurs before ovulation and it is between day 5 to 14 of a menstrual cycle. We all know that the day 1 of menstruation is the onset of bleeding or menstruation. So from day 5 to 14 of the menstrual cycle is the proliferative phase which follows the menstruation. During this proliferative phase, there occurs restoration of the epithelium from the preceding menstruation. And the length of the menstrual cycle varies due to variations in the length of this phase. That is, in some females, the duration of the menstruation can be from it ranges from 3 to 7 days. So that variation in the length, it is mainly due to this proliferative phase. And during this phase, the hormone estrogen increases. And this increased estrogen causes endometrial thickness. The thickness of the endometrium, which lines the uterus, will increase. Also, the uterine glands will get drawn out, so they will become lengthened. But the endometrium is non-secretory, and during this proliferative phase, that is from day 5 to 14, the endometrial thickness averages around 3 to 5 millimeters. Proliferative phase is usually followed by the secretory phase, which is also known as the luteal or progestational phase, and it usually occurs after the ovulation. And the duration of the secretory phase is constant. It is not like the proliferative phase. Here the duration is constant, that is 14 days. And it is during this phase there occurs preparation of the uterus for implantation of the fertilized ovum. And during the secretory phase, there occurs increase in both the progesterone as well as estrogen because the corpus luteum will begin to secrete estrogen and progesterone. So there is an increase in the estrogen and progesterone during the secretory phase. And it makes the endometrium highly vascularized as well as slightly edematous. And the uterine glands become coiled and tortuous glands, and it also begin to secrete clear fluid. So it is a secretory type of endometrium during the secretory phase. That is why the name secretory phase. And during the late phase of the secretory phase, it also begin to secrete the hormone prolactin, but the function of the hormone prolactin in this case is unknown. And during secretory phase, the endometrial thickness averages around 5 to 6 millimeters. And the secretory endometrium is the one which provides the stored nutrients to the fertilized ovum for implantation. So during secretory phase, basically the endometrium prepares for the implantation of the fertilized ovum, and it will also provide the nutrients to the fertilized ovum for implantation. Next, the secretory phase is followed by the menstruation. If there is no fertilization means, we have already seen that in the ovarian stages or in menstrual cycle, the corpus luteum begin to involute. We know the corpus luteum is the source of estrogen and progesterone. When the corpus luteum involute, the level of the estrogen and progesterone decreases. So this low level of the estrogen and progesterone is responsible for menstruation to happen. Menarche, it is the first menstrual period occurring in a female, and this usually occurs between 11 to 15 years of age. Whereas the term menopause, it is used to describe the stoppage of menstruation. That is, by the age after 45, the female, there will be cessation of the menstruation, and that stoppage of menstruation, it is known as the menopause. Because of the involution of the corpus luteum, there occurs a withdrawal of the hormonal support. So, it can lead to two changes in the endometrium. That is, the endometrium becomes thin. Almost, it becomes 65% less thickness. The thickness decreases to almost 65%. So, thin endometrium will result, and it can result in focal necrosis, and these focal necrosis can collapse together. At the same time, there occurs spasm of the spiral artery supplying the uterus. It is because of the effect of the prostaglandins, and it can cause spotty hemorrhage. Because of the spasm of the spiral arteries, it can result in spotty hemorrhage, which will also become confluent. So both the focal necrosis collapse together with the occurs spotty hemorrhage, which become confluent. So all these changes will result in the sweepage of blood through the vascular layer in the endometrium, resulting in the spread of hemorrhagic areas. And finally, the necrotic outer layers will separate from the uterus. So, blood in the uterine cavity, along with the mass of these squamated cells, along with the contractile effect of the prostaglandin, which is present in the desquamate, all these will together initiate the uterine contraction, and finally resulting in the expulsion of the uterine contents as the menstrual flow. And this menstruation will occur after 4 to 7 days of the onset, and blood ceases as the endometrium get re-epithelialized, and again the new cycle starts. Regarding normal menstruation, the blood is coming mainly from the arteries. So the blood is predominantly arterial, and venous contribution is only around 25%. And the normal menstruated blood, it contains tissue debris, prostaglandins, as well as the fibrinolysin. And we all know that it is the fibrinolysin which makes the blood does not clot normally. So the menstrual blood also does not clot normally because of the presence of this fibrinolysin. And the normal duration of this menstruation ranges from 3 to 5 days, but it can be as short as 1 day or as long as 8 days. And the amount of the normal menstruation averages around 30 ml, but it can range from simple spotting to 80 ml. That is about the endometrial changes happening during menstrual cycle. Thank you for your patient listening, and keep on watching Physio Exam Buddy, which makes your physiology exams more easy.